Good morning, dear students. I'm introducing you to a brand new topic from public health dentistry, but it is a very old concept. Okay, that is nothing but ethics in dentistry, especially. I want everyone to just read what is being projected and let it sink in for a moment. That is, do unto others as you would have them do unto you. Let it sink in, guys. Okay. Now, the contents of today's lecture, which I'll be doing, mostly I'll try and finish the various principles of ethics. Okay, the rest of it, that is a Hippocratic oath, the duties of a dentist towards his colleagues, his patients and community, and certain unethical practices might be mostly dealt in the next few classes. Okay. Now, please read and try and understand. That is, every patient carries his or her own doctor inside. Don't you think so? Yes. Most of us, we might have already come across. I know you guys are been into clinics, and the patients, whatever you come across, they might have a tendency to teach you as well, right? Yes. So that is the scenario. Please understand, this is the scenario in which we live currently. Okay. So we have certain obligations to our patients. Please understand that. And that is where ethics comes in. Now, 4 phases of modern medicine. This is just for your information. We all strive for intentional benefit for a patient, though we end up in unintentional harm. Sometimes we come across that. But unintentional benefit is still possible. Okay. But it is rare, but it is still possible. You know, the D which is given here is intentional harm. That is banished. In totality, it is banished, but it is not yet eliminated. That is the small loophole that we all face in our medical or dental profession. Okay, it is not yet eliminated. There are still some antisocials who have that tendency. Okay, yes. Now coming to ethics. Ethics is a branch of philosophy or study of what is right and good with respect to character and conduct. It is basically nothing but distinguishing what is right from what is wrong. Okay. Now, there is personal ethics and professional ethics. Personal ethics means what? That is nothing but your own ethical well-being. Well-being in the sense, your own ethical behaviors, your own ethical conduct to any person in your society. Okay, acting in your own capacity. That is personal ethics. But what is professional ethics? It is nothing but all your personal ethics and the professional standards which you have to maintain combined together is professional ethics. Okay. Now, what is dental ethics? Dental ethics is defined as the moral duties and obligations of a dentist towards his or her patients, professional colleagues, and his society. Okay, not just his society or his patients, but also to his professional colleagues, to your friends, that is to your dentist friends. You have some certain obligations, and so you have to behave in certain ways. You have certain duties and obligations towards them as well. So all this, if it is combined together, it is known as dental ethics. Okay, so the dental ethics applies moral principles and virtues to the practice of dentistry, and with that we'll come to the various important 5 principles of ethics. This is in general. Okay, and this holds good in every places of life, in every phases of life. Okay, not just for your dental professionals, but also in every phases of your life. That is, the first is autonomy. That is basically respecting other persons. Okay, beneficence, to do maximum good. Non-maleficence, to do no harm. Justice, treating everyone equally. And truthfulness. Okay, these are the 5 principles, even though 4 are listed here. Okay, so the rule 1 is do no harm. That is the prime most rule. You are at a higher capacity. When you have a patient, he is liable to you. Okay, and you are also equally liable to the patient. Okay. So that is rule 1. Do not harm. That is a universal law. From your childhood, you might be taught by your parents, then your teachers. Same thing. That is, do not harm anybody. You don't have that right to harm anybody, intentionally or unintentionally. Okay. So that is non-maleficence. So what does do not harm from a patient, from a dentist point of view, is he has to refrain from harming the patient. He has a millions of ways to harm a patient, right? Yes, you, by the time you might have already known, come across such scenarios. So it is refraining yourself from harming the patient, keeping your knowledge up to date, your skills up to date. All right. Then use of sterilized instruments. Please don't overfill or underfill. Okay. Be careful in handling soft and hard tissues. So these are some of the ways by which you can cause no harm to the patient. All right. Yes. Now the second important is to do good. Maximum do good. Do good and good will always come to you. That is a universal principle. Do good and do maximum good will come to you. You might have heard of it from your childhood days onwards. Yes, it is a principle of promoting or doing good. Always think about the welfare of the patient, okay, and put the patient's best interest as priority. Yes, that is, I think it requires no more explanation. It is self-explainable to do good. Now, read this and let it sink in for a moment. Go into the world and do well. But more importantly, go into the world and do good. That will be always remembered. That will be repaid. And that will be remembered with gratitude. Okay. So this is one message which I have to share for today as well. Now, the third is respect for persons. Okay. And here you will deal with the new word, autonomy. Autonomy is nothing but respecting a person's decision or his self-determination in making decisions. You are going to respect person. Okay. So that is the highest form of respect that you can give to anybody. Respecting someone is simply by abiding to their choices, whatever they have made. You need not interfere and give your own choices. Okay. That is the simplest meaning. The dentist should educate the patient to his or her best regarding the treatment. It is always our duty to educate our patient on whatever possible treatment modalities are there, whatever are the other options, everything, alternative options, everything. But you should always leave the choice to the patient. It is not you who should have a paternalistic mentality and take the decision for your patient. That is not right. Okay. So that is what is encompassed in the principle autonomy or respect for persons. Okay, I hope it is understood. Now, this cartoon explains it very well. So here is a chicken asking another, what happened? I thought you went to the dentist for a cleaning. But the other says, I did, and then I got a cavity filled. This is what happens most of the times. Yes. Okay. So it is nothing but, why do you always have to be paternalistic? We don't have to be. Leave the choices to others. It is their life, their choices, their treatment needs, which they require most. So let them take the choices. It's not you who have to take choices for them. That is a major idea. So one another major aspect which you have to study under autonomy is informed consent, the importance of informed consent. Informed consent is you are basically informing the patient on all the possible side effects, all the possible benefits, all the possible treatment modalities, all the other alternatives, everything you are going to inform the patient and let the patient choose. Okay. An informed consent is ideally required before starting any procedure or before even the examination. So it should always be voluntary. It should be legally competent and it should be well informed. And you should make sure the patient understood everything, whatever you are going to say. Okay. And leave it to the patient. Let him decide. So informed consent is also an important concept under respecting for persons. Now, the next or the fourth important principle is justice. Justice is treating people fairly without discrimination of socioeconomic status, their race, their gender, their creed, color, sex, national origin, all these things. Treating everyone equally. Okay. And the last principle which we will deal today is truthfulness. Truthfulness. Okay. So it is nothing but, it is not just a patient-doctor relationship, but I believe every relationship, be it a friend to friend or a mother-father or a mother-daughter, mother-son, father-daughter, or any other relationship which you can imagine, husband-wife relationships, everything is based on truth, right? You have that background or that strong pillar of truth. It is all based on truth. So similarly, patient-doctor relationship is also based on mutual trust. The dentist has a duty to communicate truthfully, not hiding certain information, not lying to the patient, all such stuff. So the patient, also one thing is there, the patient, when he comes to you, he expects the dentist to be truthful about the information given, treatment rendered, and the prognosis, everything. All right. Yes. So if it is not right to do, don't do it. If it is not true, do not say it. That is the golden rule which you have to always bear in mind. Okay. To render an ethical practice. See, this is one of the character from, I think, one of the Netflix series. So when the truth can't help someone, we should lie. This is the character in the series is projecting this. When the truth can't help someone, we should lie. How many of you believe in this? I rarely doubt. Lies don't protect you from the truth, and that is the important thing which you should understand. Lies don't protect you from the truth. And what you have to always bear in mind is, don't ever lie to someone to protect their feelings. They deserve the truth. Everyone deserves the truth. Okay? So don't ever lie to someone to protect their feelings. They deserve the truth. With this, I think I'll be stopping here for today. So in conclusion, we have just seen what are the various ethical principles. The prime and most important is to do no harm. You have to do good, be truthful, respect other persons, and justice. Okay. The rest of it we will deal in the next class. Thank you and have a nice day.